Alison McConnell's sentence may not be heard for several months. Well, doctors are supposed to improve the health of their patients, but Peter Chang managed to infect 9 of his in one day with a potentially deadly infection. And all because he couldn't be bothered washing his hands. Yet, as David Eccleston explains, he's still allowed to work.
Dr. Chang, David Eccleston from Channel 7, how are you?
Good, thank you.
I would offer to shake your hand, but you have a bit of a history of not washing your hands, don't you, sir?
This doctor should not be practising medicine.
In fact, your hygiene is so poor that 9 of your patients in one day were sent to hospital with symptoms of septicemia. Isn't that right, sir?
That's correct, yeah.
9 patients in one day, that's a considerable worry.
Dr. Peter Chang is lucky not to have blood on his hands.
You were careless in your duty of care, weren't you?
Yeah, but that's 3 years ago.
Right, so how many more chances should you be given before your carelessness costs someone their life?
For the dirty doctor, the devil is in the detail.
But what is this about?
The medical tribunal's findings were damning, raising questions as to how this man is still allowed to treat patients when he doesn't even maintain the most basic of hand hygiene.
Dr. Chang guilty of unsatisfactory professional conduct and professional misconduct. In the findings, it said the practitioner routinely failed to wash his hands. He was in breach of infection control standards.
But this isn't the only indiscretion, is it, sir? This is just the tip of the iceberg, because the findings also found that you failed to keep a log of when you sedated people. You failed to have an assistant with you when you sedated people.
It was true negligence. There were so many facets of what he did on a daily basis that would lead a patient to potential death.
Medical commentator Dr. John Darcy.
There are countless failures, even something as simple as not wearing gloves when he cannulated a vein to inject narcotics so that they could fall asleep during the procedure, and not using gloves. That was an opportunity for bugs on the outside, on his body or on their body, to get inside and into the blood, into an area where there should be no bugs.
In terms of infections, sepsis or septicemia is at the top of the nasties list, according to Dr. John.
Nothing could be a better food for a bug than blood. So if you get bacteria, which shouldn't be in the blood, into the blood, it's a little bit like feeding the chooks. They go crazy. If the bacteria start increasing, that infection spreads around the body and goes to every cell in the body, and that's exactly what septicemia does. It affects every cell in the body, and that's why it can lead to death.
The report found that Dr. Chang routinely retained partially used vials of propofol, the same drug that killed Michael Jackson, for periods longer than their expiry date, and failed to have an ECG and a defibrillator on standby.
If you anaesthetise a patient on your own and then go about doing some other sort of procedure, that's a potential disaster.
Are you fit to be a doctor?
Yes, I am, yes.
How can you guarantee that that won't happen again?
Speak to the medical board.
No, I'm speaking to you. You're the doctor.
Yes.
How can you guarantee the safety of patients when they put their trust in you?
We've had some data on him now going back some years. It's been the same pattern. He should have been reined in years ago.
Lorraine Long is founder of the Medical Error Action Group and wants Dr. Chang struck off. She points to an alarming omission in the report. According to Lorraine, in September 2011, 1,700 patients who had seen Dr. Chang in the months prior were told to seek blood tests for hepatitis B, hep C and HIV.
1,700, not 17, 1,700.
How can you guarantee that they won't end up in hospital because of your carelessness?
Of course, I've rectified everything.
What, you wash your
Okay?
hands?
Yes, that's right.
The Healthcare Complaints Commission, or the HCCC, would not discuss the case with us, but drew our attention to the restrictions now imposed on Dr. Chang. These include a ban on using anaesthetics for sedation. Many would agree that with his sloppy track record, the dirty doctor got off lightly.
What does it say for our medical board? What does it say for our health department? And what does it say for the education of doctors going through medical school? There's a failure somewhere, and that needs to be looked at.